Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. Do you ever feel lightheaded or dizzy when you get out of bed in the morning, or feel like you're spinning when you're not? If so, you could have a balance disorder. Over 90 million Americans will experience a balance issue at some point, and balance-related falls account for over half of all accidental deaths in the elderly. You may not know this, but the key to maintaining balance starts in your inner ears, also known as your vestibular system. So today, we're talking about vestibular therapy, physical therapy for your inner ears to get you back on your feet and keep you there. WVU Medicine physical therapist Miranda is here to explain how vestibular therapy works and how it can stop the dizziness and spinning to improve your quality of life. Welcome, Miranda to Live Healthy West Virginia.
Thank you, Mary, for having me. I'm very excited to be here.
Well, it's good to have you here. So let's just start with the basics. What is vestibular rehab?
Okay, so vestibular rehab is a specialized type of physical therapy. We use to treat dizziness, vertigo, and vertigo is like a false sense of movement, often described as spinning, and also imbalance. So
Okay.
A physical therapist will evaluate the patient and their specific symptoms, head and body movements, their balance, and their gait to come up with a treatment plan. The treatment usually is an exercise-based approach to retrain the body and the brain to accommodate for vestibular deficits.
Okay.
We also provide home exercises to the patient to that they can learn to do at home to help with their symptoms. And also education is a big part as well to help them to learn strategies to manage their symptoms.
So what exactly is considered the vestibular system?
So the vestibular system is in our inner ear, and it's a sensory mechanism. So it has 3 semicircular canals, and they are sensitive to rotational movements, so turning our head. That helps us kind of recognize that. We also have something called otolith organs, and they are sensitive more to gravity and like linear acceleration. And so those work together to kind of recognize that movement, and then they send signals to the brain. And so then the brain can kind of incorporate that to help maintain our stability and balance.
Okay, so it all starts in our ears.
It all starts in the inner ears.
I don't think a lot of people realize that.
I don't think they do, yes.
I didn't realize that till this happened to my mom like 10 years ago, and she went for vestibular therapy, and I was just like, really? That's it? That's all you have to do?
Yes.
You know, I think it's fascinating. So who needs to have this treatment, this rehab?
So if anyone is experiencing dizziness, vertigo, imbalance, or sometimes they feel like having blurry motion when they turn their head or turn around, those are typically symptoms that would benefit from a physical therapy evaluation and determine if vestibular rehab would be the right approach for them.
And can this happen to anybody at any age?
Any age.
Really?
It doesn't necessarily, have to be an older population issue. Young people have this as well. So it can hit you at any age.
Do we know what causes it?
So there's various things that, sometimes it could be, depending on what you're talking about, some can be by trauma, like to the head. Sometimes disease processes can irritate structures within the inner ear, and sometimes the causes aren't known.
Okay. So it's a little bit of everything there, huh? What are the most common conditions that you treat with vestibular rehab?
Okay, so among the various ones, probably the 2 most common are a vestibular neuritis, or sometimes called vestibular hypofunction. So basically meaning, it's functioning at a low level.
Okay.
And then BPPV. So those are probably the 2 most common treatments.
So what is BPPV. I want to make sure I got the letters right.
Yes, so all those letters. So the BPPV stands for benign, positional, paroxysmal, vertigo.
Okay, I know what 3 of those words mean.
Yes. So the benign means that it's not life-threatening. Positional means it's brought on in certain positions. Paroxysmal means that it's a sudden onset.
Okay.
And then vertigo basically means it's a false sense of movement. So you're not really moving, but you feel like you're spinning or the room is spinning. So that's what true vertigo is, compared to like dizziness. Dizziness is sometimes more of just like a feeling of just off balance. Sometimes people describe their head as like feeling like it's floating. So that's more of like a dizziness versus true vertigo.
Okay. How do you treat that then? How do you treat BPPV? And you also mentioned vestibular neuritis and hypofunction.
Yes. So BPPV, what it is, we have these, they're otoconia, but sometimes people call them ear crystals that are part of the vestibular system. And they're supposed to be in a particular place. But sometimes they can detach and kind of move out of where they're supposed to go into those semicircular canals we talked about.
Right.
So then when you turn your head or you lay back, those otoconia move and cause that false sense of movement. So our brain is getting this signal that we're moving, but we're not really. And so that's what causes the vertigo. Oh. Now, sometimes when you kind of stop moving, they'll kind of settle, kind of drop down, then the vertigo will stop. But as soon as you kind of move again, they're going to be reactivated. So to treat that, we start with positional testing. So we'll take the patient into a position to determine which ear is involved and which canal, because there's 3 canals, so we have to determine which canal is involved. And then based on that information, we can actually take the patient through like a specific sequence of movements, like of their head and body, and that helps kind of guide those crystals out of the canal and back to where they're supposed to be. And so this treatment is usually pretty successful with actually 1 to 2 treatments. And then we kind of follow up with the patient, monitor their response. And then, of course, if they have other issues like balance and things like that, we can address those as well.
So the main goal is to get those crystals back sitting where they're supposed to be in your inner ear.
Absolutely.
Wow. I just think that's so cool.
Yeah, so that one's good because it's a quick fix. You can usually fix within a few visits, and then the patient can kind of get back to their normal activities
like it never happened.
Yeah.
Now, is that how you treat neuritis and hypofunction?
So neuritis is a little bit different. So It does not involve the otoconia. So this is more an inflammation of the vestibular nerve. So sometimes that could be caused by a viral infection, disease processes, trauma. So a blow to the head could sometimes cause inflammation, or sometimes we don't always know exactly what the cause is.
Yeah.
But the vestibular nerve is how we kind of send that information to the brain. So if it's inflamed, that information doesn't get there properly, or as much information doesn't get to the brain. So we kind of lose that sense of awareness that we get from our inner ear. And so this will lead to dizziness, imbalance, sometimes vertigo, motion sensitivity, and vision. So whenever we turn our head, sometimes our vision doesn't stay clear because the inner ear also and the brain also control like coordination of the head and eye movements. So they have to work together to maintain a stable vision while we're moving.
Okay. So how do you treat that then?
So those is a combination. We use some gaze stabilization exercises. And so those specifically work on the VOR, which is a reflex called the vestibulo-ocular reflex. So it's where the vestibular and the eyes are working together. So we do exercises to retrain that. So where you kind of focus on an object, you're going to turn your head, do different motions, trying to keep that stable gaze. And it's just like a weak muscle, we can kind of retrain that reflex to improve. We also do habituation exercises, and that's where we kind of gradually expose patients to a triggering motion And then over time, the brain kind of learns and kind of gets desensitized. And then that motion becomes like a normal, they get a normal response to it.
Yeah.
And then, of course, balance and, balance training, gait to work on their stability and safety.
All through exercise.
All through exercise.
We've not even talked about medicine once, medication.
No, yes.
You don't need it.
You don't always need it. Sometimes patients, they may get some, the doctor may prescribe like a meclizine or Anavert, something like that, if they're having some severe nausea. But a lot of times we find that prolonged use of that can actually delay the brain's response to, because they are usually suppressants, and it kind of delays the brain's response to relearn.
Okay. Well, that makes sense. So how long does typical treatment program last?
So it varies depending on, what diagnosis and, of course, the severity. So, like sometimes it may take just 1 to 2 visits, like sometimes it's BPPV. If that's kind of the only issue they have going on, we may be able to treat them in a few visits. Whereas some might take a little bit longer. Usually a vestibular neuritis is going to take closer to 6 to 8 weeks to really see good recovery. Yeah. And also one factor that kind of plays into recovery and length of treatment is consistency with your home exercise program. So
gotta be a good patient.
Absolutely. Yeah. So the more consistent you are with your home exercise program, the faster you're going to see improvement in your symptoms.
You want to get moving, you got to keep moving.
Absolutely. Absolutely.
Absolutely. Now, you did mention that you give home exercises, and it's important to do them. But my question is, when you're done with the therapy, and I know you still give them home exercises, do you have to keep doing these exercises like the rest of your life to make sure those crystals stay in place, or, to keep that from recurring?
So for BPPV, you don't necessarily have to do any specific exercises to necessarily keep that from recurring. Okay. And then some of the exercises, even with other diagnoses like the vestibular neuritis, some of those exercises we can definitely, as you progress and improve, we can definitely kind of taper those down. But one thing I do recommend all patients to continue is a program that still focuses on balance, strength, a walking program, because those are the things that are going to help with your mobility, just overall general health, and just help you to be as steady and stable during your daily activities. So that's the best way to kind of prevent recurrence, and also to decrease your risk of falls. Because the stronger you are, the better you are with your balance, the less likelihood you are of having a fall.
And your risk is higher as you get older.
Yeah, absolutely.
Yeah. Well, that's good to know too. So what should somebody do if they're experiencing what we've been talking about, dizziness or vertigo?
Yeah, so if they're having this new onset or feel like it's been a problem for a while, I definitely recommend that they contact their physician, kind of describe what's going on, and even talk to the physician about physical therapy. Getting a referral for physical therapy can be beneficial, because then we can kind of evaluate and determine, specifically if they need vestibular rehab and what would be the best course of action for them.
Okay, good to know. So what would you consider are the most important benefits of vestibular rehab?
So vestibular rehab really helps with, I think, improving safety, because, balance is so important at all ages, but especially as we get older. We want to really minimize fall risk, as much as we can. So fall prevention, education is key. And so balance, kind of goes right in with that. Mm-hmm. Dizziness, vertigo, all of those kind of play into the safety factors. Okay. And so I think, by minimizing the dizziness, the vertigo, and helping them kind of get back to their daily activities, teaching them exercises to kind of maintain the gains that they get during therapy, to continue beyond, I think will help with just overall quality of life and safety.
Good to know. Okay. Is this kind of therapy usually covered by most insurances?
So yes, so it's covered under, so vestibular rehab is covered under physical therapy. So, most insurances cover physical therapy. Now, you may have to check with your specific provider just to find out specifically what your benefits are as far as, how many visits and things like that. And we usually, come up with a plan of care, and we kind of write how many visits we think that we're going to need and the time frame. And most insurances will kind of work within that.
Okay. So I want you now to talk a little bit about the expertise of the WVU Medicine Physical Therapy team. Because, full disclosure, you treated my husband.
Yes.
Who was having dizziness and a little bit of lightheadedness after he was in a car accident. And that was the first time I got to see really the inside of the WVU Medicine Outpatient Rehab Center. Wow.
Yes. It's a pretty...
so let's talk about how great that place is and about the team.
Yes. So the whole rehab team involves physical therapy, speech therapy, and occupational therapy. We have an exceptional team. The therapists all have years of experience, and they have a lot of expertise in subspecialties. So orthopedics, sports rehab. We have a neurologic therapy team. We have lymphedema management, aquatic therapy, pelvic health. So there's a lot of experts just housed within our, rehab
It's a one-stop
facility.
shop, but you've got specialists for every part of the body.
Absolutely. We really do. We really do. And the building, it's the state-of-the-art, brand new facility. We have the most up-to-date equipment, technology. You really couldn't ask, pretty much whatever we've been able to get all of the toys,
Yeah.
And it's great. And just as clinicians too, not just necessarily that we really all have, we strive to improve our patients' lives. We're really invested in helping our patients kind of get back to what they want to do. And so we work well as a team to create like a positive, welcoming environment. And a lot of patients will say that they enjoy coming for their therapy, visits. It's not something where they're like, they dread going. They really come, they enjoy it. And sometimes they feel like they're, I'm going to miss it when we're done.
Yeah.
And so that's nice to hear, because then that you've been able to make that positive impact on your patient's life. And that's really what it's all about.
Great. And one more question there regarding that. You usually need a referral for this kind of therapy, don't you?
Yes, it's you want to have a referral from your physician. It can be from an ENT. Pretty much any doctor can prescribe physical therapy.
Okay. All right. Good to know. So before we go, what's the most important thing you want our viewers and listeners to know about vestibular rehab?
So a lot of people don't realize that there is therapy out there or treatments for dizziness, vertigo, the imbalance. A lot of people think, oh, well, I'm just getting older, so this is what I expect. Or they're like, well, it'll go away. I'm just going to wait it out. You don't have to do that. You don't have to suffer through, these symptoms. You can actually have treatment. So the first step is to see your doctor and talk to them about your symptoms and ask them about a referral for physical therapy, because then we can evaluate and determine if vestibular therapy is the right approach for you to treat your symptoms.
You don't have to live with it.
You don't have to live with it.
And it's such a simple solution.
Absolutely.
It's great. It's great. Well, thank you so much for sharing all this information. I hope we Hope a lot of people learned a lot of
I
things
hope
about
so.
something
I
they
hope
didn't
so.
know about.
Yes.
We're going to help a lot of people today.
Yes, I'm very passionate about this. This is what I love to do. And so, anytime we can get that information out there about it is good.
All right, great. Well, that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information on balance disorders or other conditions, visit WVUmedicine.org. And to find the latest episode and all episodes of Live Healthy West Virginia, visit wvmetronews.com/podcast or the Metro News TV app. I'm Mary Ravazio Menard, and on behalf of Miranda Hose and everyone at WVU Medicine, thanks for joining us.